We now have 273 cases, the vast majority of those which were community acquired with no known source of infection. I'm extremely sad to share that 6 more Tulsa County residents have died, including the youngest resident to date, which is a male in his 20s, bringing the total number of residents who have died in Tulsa County to 14. These numbers will continue to climb, which is why it's absolutely necessary and critical to adhere to CDC, Tulsa Health Department, the recommendation you hear from the City of Tulsa, Tulsa County, those guidelines to stay home as much as possible, practice social distancing, wash your hands frequently, and avoid close contact with sick individuals. With COVID-19 spreading in our community, your choices and actions should reflect that. I'm starting to hate this virus. I hope you do as well. It knows no boundaries, not geographic locations, not race, not gender. It's spreading in North Tulsa, South Tulsa, East Tulsa, West Tulsa, Midtown, and all of our surrounding communities. Everyone should wash their hands with soap and water as much as possible. Use hand sanitizer with at least 60% alcohol if soap and water are not accessible to you. A lot of people have asked me if they should wear gloves in public, and in all honesty, gloves are no substitute for washing your hands. Leave your gloves at home. Save them in case someone in your household becomes sick. You'll need to wear gloves when handling items a sick person has used, such as their dishes, laundry, and other household items. Thoroughly clean and disinfect your home using the guidance available on the THD website. Stay home as much as possible.
I honestly couldn't believe it when he just said it's been a month and a day. It feels like it's been about a year. I want to remind folks one of the, I think, most valuable things that we can provide at these briefings is information and access to information so that you can make informed decisions to protect the people you care about. And a handful of what I've found to be the best resources out there would be, number one, the Tulsa Health Department's website. In particular, they have a landing page for this particular event. You can go to that. You can see all the latest information on the number of people diagnosed, a lot of other information relative to COVID-19, as well as the latest best practices to keep yourself and your family safe. So I highly recommend a visit to the Tulsa Health Department website. Second, our City of Tulsa website, cityoftulsa.org. If you go to that, you'll see a bar flash up at the top for the COVID-19 resource page. You can go on that, and it has links to just about everything that I, as the mayor, would be reviewing or have access to make decisions on this event. All of the legal documents, all of the latest data portals, everything that we've talked about at these to date, as far as the data sources are concerned, you can go to that page and access those yourself. The last one is the website, and you can find this on the cityoftulsa.org website as well and click through to it, tulsaresponds.org. That is the site for business owners to access very quick, immediate, no interest loans for you to tide you over until the much larger federal funding becomes available for our local business owners to tap into to get through this event. Considering the fact that, you can't help but pause and think about, a month ago when we knew that there was one person in our whole city who had been diagnosed with this virus, this disease, and it still, for a lot of us, seemed like something that was happening in other cities and other countries, something we read about on the news. And now, a month later, this is something where we see our friends on social media who have it. Every day now, it feels like there's a new heartbreaking story about a wonderful person in our community who's passed away as a result of it. I do want people who have this, who might happen to be seeing this briefing today, if it's today or if you see a recording of it later, to know how much support the people of Tulsa have for you, that you have a community here that is rallying behind you in a way that it has never rallied behind anything ever before. And I hope that you can feel that as you're going through this, both for the people who have it and for their loved ones who are either caring for them at home or who are isolated from them because they're in the hospital. Please know that the people in this city care about you, and we're doing everything that we can as a community to keep our healthcare infrastructure in a place that you can get the healthcare services that you need to get through this and get back on your feet.